In case of institutional deliveries, the number of postnatal home visits to be provided by ASHA, that is accredited social health activists, or ANM, auxiliary nurse midwife, for observation of mother and newborn, or option A 3 and 6 respectively, option B 4 and 7 respectively, option C 7 and 14 respectively, option D 10 and 14 respectively. In the case of institutional deliveries, the guideline recommended that the number of postnatal home visits provided by ASHA, that is 3, while ANM, that is auxiliary nurse midwife, is expected to make 6 such visits. The primary objective of these postnatal visits is to closely monitor and ensure the health and well-being of both the mother and the newborn, addressing any complications or health issues promptly. So the correct answer is A 3 and 6.